Okay, well, we're going to go ahead and get started here. First of all, thank you for to everybody who signed on this week and joined us. For those of you that don't know me, I'm Art Terrazas. I work here in our public policy department at ACA headquarters. Usually, Scott is Barstow, our public policy director, is our moderator for the calls, but unfortunately, Scott had a scheduling conflict today and is down at the Department of Education. We're doing some work there and having some meetings with some folks. So, unfortunately, you're stuck with me today, so I'll try and make it as painless as possible.
What's your name again?
I'm sorry?
Your name again? Your name again?
My first name is Art, and my last name is Terrazas.
Okay, thank you.
No, not a problem. And just as a reminder, if there's something that gets missed on the call, we don't get to cover it again. We are recording the call and we'll be posting it up later so that you can go back and listen to the call at your leisure. So we just want to cover a couple different topics today, and then we'll go ahead and open it up for questions after each issue. There's been quite a bit of things that have been going on, and we want to make sure we get everybody updated. I think the biggest issue or development that we've had is that I think a lot of you probably have heard about the fact that the Office of the Inspector General had released a report last a month, I believe, on the VA Department of Veterans Affairs not providing the adequate mental health care to veterans that they were supposed to be doing, and there was a lot of questions and even a little bit of anger, I think I could say, on the Hill about the VA falling short of its goals. And the VA, in response to this report, made a couple of different announcements. And first was the announcement that they were creating 1,600 new positions for 1,600 new mental health clinicians. And then a couple of days later, they issued another press release saying that they were going to focus exclusively on hiring licensed professional counselors and marriage and family therapists for those positions, to which we here at ACA said, it's nice that you're focusing on us, but you've had that ability for almost 6 years. And so obviously we were a little upset, a little discouraged at the fact that this was going on with our veterans, and so ACA engaged in a bit of a media blitz with different newspaper outlets in different parts of the country. And basically what we were talking to them about is that, the VA has had the ability to increase their mental health staff for many years, but we being the counseling community have been continuously shut out and not hired at the rate that we should have, and positions have not been created at the rate that they should have to really involve and bring counselors into the VA community, and also, more importantly, to get the veterans the help and the mental health care that they need. We had some success. I think if you go to our website, you'll see a couple of different interviews that we've posted on there, and some more will be coming up. We're doing interviews in all over different parts of the country. I think we had one down in Texas. We had interviews in Washington State. I think we had a couple of national pieces with the Army Times, which got republished for each service branch of the military. And so we're getting some feedback on that, and it was good to go out into the public sphere and talk about the fact that this is not something that, initially it's going to go away. We're going to be here. We're going to continuously work with members of Congress and the Department of Veterans Affairs to basically hold the VA accountable and make sure that they're doing what they need to be doing. Since this has been going on, we've noticed that there's been a change and a slight increase in the numbers of counseling positions that are open and posted at usajobs.gov. It's far from where it should be, but at least we can see some positive movement in the direction and in our direction. Were there any questions on that issue before we move on?
Yeah, I'm just wondering, Art, I understand that this is only within the VA. Is ACA planning to look at independent practitioners that are LPCs or LMFTs? Is that something in the works? look at independent practitioners outside of the VA facilities?
Well, we're always going to be looking at that issue. I think this one is more specific because we had a clear clear statement from Congress in the form of a federal law several years ago that they wanted to have the VA start including us, and that has not happened.
Right.
So we want to make sure that because we've got that issue, and then we know that their funding for mental health has been increased year after year since that law has been passed, and they've now created these new positions, and also those 1,600 positions that were created are in addition to 1,500 vacancies that already exist within the VA healthcare system. So we always concentrate on as many people as we can. This is just one area of focus, though, where we're kind of drilling down to the brass tacks to make sure that they're implementing policies and procedures that are going to benefit counselors.
Okay, thank you.
Mm-hmm.
I have a quick question regarding
Sure.
the VA. Although they're creating positions for mental health counselors, licensed mental health counselors, how does that work with relation to obtaining internship positions? Because I have tried a great deal to get into the VA. I'm in New York, and they just, we're very social work driven here, and they won't, they will not look at me because I'm a mental health counseling field. Do you know anything about that as well?
Well, actually, it's interesting that you mentioned that because in our talks with the VA and a hierarchy, if you will, that issue has come up because that is one area where it's a pathway to a career in the VA, and
Absolutely.
we've had meetings with the director of the Office of Academic Affairs, and we even joined up with some of our partners at NBCC and AMCA and AMFT to talk about this, and we saw that as one of those specific policy changes that VA needs to make to start being more inclusive of counselors. And one of the issues that we're raising with members of Congress and the VA is that we had sent the letter, our coalition sent a letter to the Undersecretary for Health, Dr. Robert Petzel, and said, we want to be included in this program. We know that you're starting to get the budget ready for next year, the next fiscal year, and we think that you should set aside some slots for counselors. And the same day that the press release from the VA came out saying they were going to specifically look at recruiting counselors, our coalition got a response in that letter from Dr. Petzel saying that our discipline was not deemed to be part of the national interest of trainee and internship programs. And so one of the things we're bringing up, and we've brought up in the interviews and taken the VA to task on, and we're going to continue to do that, is we fail to understand how you're going to be you're supposedly recruiting counselors, yet a basic tool for recruitment is we're shut out of that out of the gate. That doesn't make any sense to us. So can you please explain to us how you're recruiting us but not using recruiting tools? So it's an issue that we are aware of and we're equally upset about because there's no reason why we should be left out of that process.
Okay, thank you. I agree.
Problem.
Thank you.
Are there any other questions in regards to this? Okay. I think the other thing that we wanted to cover, because now that we're getting closer and now in the month of June, is that this is begins to get into the time of the year where the Supreme Court is going to release its opinions on cases that it's heard during the term. And, of course, one of the big opinions that the whole country is waiting on is the decision on the lawsuit that was brought forward on the Healthcare Reform Act, the Affordable Care Act. We don't know here at ACA what's going to happen. We're just like everybody else and waiting with bated breath to see what the court's going to do. They have different options in front of them. They could let the law stand in its entirety. They could strike down different provisions. They could strike down one singular provision, or they could strike the entire law out completely. So we're going to have to wait and see how what the opinion is, and then determine how that's going to affect counselors and practices. Just as a reminder that ACA was supportive of the Healthcare Act, and I think there was probably some white papers that or a statement that was probably released when the bill was going forward. But just like everybody else, we're going to have to wait to see how this all shakes out, and it's not something that we can easily predict. And speaking of some issues regarding legislative actions and constitutionality, Scott did want me to mention to you all that our friends down in Arizona have enacted some new legislation, kind of the second type of legislation they've done in as many years. And this legislation is going to give health and social service professionals for lack of a better term, the ability to discriminate in who they're going to provide services to and how they provide those services on the basis of religion. I think the new bill is Senate Bill 1365, which goes farther than the previous bill and was signed into law. And this new bill, the laundry list as it goes right here, we're looking at, prohibits the denial, suspension, or revocation of a person's professional or occupational license, certificate, or registration for either declining to provide or participate in providing any service that violates that person's sincerely held religious beliefs, expressing sincerely held religious beliefs in any context, including a professional context, as long as the services provided otherwise meet the current standard of care or practice for that profession, providing faith-based services that otherwise meet the current standard of care or practice for that profession, or making business-related decisions in accordance with sincerely held religious beliefs, including employment decisions, client selection decisions, and financial decisions. Obviously, we are very concerned about this law. Now that it's in there, we're going to have to we'll see how it plays out. ACA is still kind of assessing what to do at this point with it. It's a new kind of frontier out in Arizona, and they're doing a lot of interesting things that are upsetting some folks, and some other folks are cheering on. But we did want to just make you all aware of that. And
Johnny Jenkins.
More of that information is going to be provided in our next issue of Counseling Today. The final thing we wanted to talk to you all about...
Art, isn't there something here in Michigan, too, that's been introduced based on the EMU lawsuit in terms of allowing counselors to discriminate based on religious beliefs?
I think there might have, and I don't have any information on that so far. I think Scott was
I know that there's a bill
that.
that's been introduced, and I'm not sure what the status is at this point. It's been turned over to our Licensing and Legislative Committee with the Michigan Counseling Association, so I don't have all that information yet. I will on Friday. But, the Arizona law came directly out of the lawsuit at Eastern Michigan University.
Yeah. No, and if you do get information, feel free to pass it on to us, because...
Yeah,
with
I know
the 50
Scott's
states, sometimes we miss information, but please go ahead and forward that over to us, because it would not be surprising.
I know Scott's been in contact with Nancy Cawley and Lisa Hawley, who have been working diligently on this. So obviously it's a concern, and certainly a sweep that we don't need across the United States, because I don't know what that's going to mean for ACA ethics or for state ethics.
Yeah, I think it puts everybody in a very difficult position. And where people are, and it's tough because they're trying to legislate this profession that they don't know a lot about,
right?
And that always gets dangerous whenever politicians get in the practice of getting into something that they're not really fully educated on or understand.
Right. Okay.
The final thing we wanted to talk to everybody about is that as we're moving on into this year, the folks up here in Washington, being the Congress, are pretty much gearing into their re-election modes, and they're going to be doing, as you probably will notice more and more in your local communities, some town hall meetings, coffees with constituents, and things like that. Probably the first big break that's going to come where they'll all leave Washington is during the 4th of July week. I believe both in the House and the Senate are out that week. You can always find out who your senators are by visiting senate.gov, and if you want to find out who your House members are, you can find that out at house.gov. And we would encourage you to do that and make sure that you're keeping in contact with your federal lawmakers, because as these town halls and meet and greets go on, it's vitally important that all of our counseling members of our counseling committee of ACA, and even if the folks that you know that aren't members of ACA, start attending these meetings and asking questions that are important to you and to the profession, because that's the only way that it's going to start getting on folks' radar screen. This is a time when politicians are a little bit more attentive because of the nature of their calendar and where they are at. And we, of course, do not take a position on telling people who to vote for, but we would like to see our members thoroughly engaged in the process of making sure they know who's on the ballot, making sure they know who their federal lawmakers are, and asking them questions about, what their thoughts are on the different pieces of legislation. I know that we want as many members of the Senate as we can to start co-sponsoring S604. That's the parity bill for Medicare, and if you're in a situation where there's a senator that's in office right now, and you know that they haven't signed on as a co-sponsor, we really encourage you to go out there and make sure that they know about the bill, that you're talking to them about that legislation, that they're signing on as co-sponsors. Likewise, if they're members of the House, we want to make sure that our members are out there asking House members to sponsor legislation that is the House counterpart to 604, because we don't have one of those right now. And we need to make sure that if this legislation moves forward, we've got one bill in the House, one in the Senate, so we can push it through and see if we can get it through this year. Additionally, for folks that are school counselors, we want to make sure that these federal lawmakers are funding programs like the ESSCP. Right now, it's not at the level that we'd like, and we want to make sure that they're providing enough funds for that, especially as we are now becoming more aware of these issues like bullying and people are getting ostracized. We want to make sure that the schools have the necessary tools to provide help wherever they're needed. Are there any questions on that? Okay. Any questions on anything else that we might not have covered or that you want to bring to the attention of the group?
I had another quick question.
Yes.
Quick question regarding New York State. Currently, licensed counselors cannot accept Medicaid and Medicare, which social workers can. And I know that's been in legislation for quite some time, and there doesn't seem to be any movement in that area. I don't know if you know where that's at, where it might be going, or has it become a dead issue?
Well, S604 deals directly with the issue of Medicare, because the Medicare is completely regulated at the federal level, whereas you see a lot more Medicaid restrictions coming in at the state level.
Yes.
So S604 would allow the reimbursement of counselors through Medicare, and so that's what we want to make sure that folks are on it. I don't believe either Senator Schumer or the other senator escapes my name right now, and I'm sorry about that. I don't believe either the New York senators are actually co-sponsors for that legislation, and so that would be something we want to make sure that they get signed on to support.
They are. Did you say they are not co-sponsors of that legislation?
I do not believe so. Not at this point.
Okay.
And just FYI to the caller from New York, it depends on
Yes.
what state you're in. Virginia, for example, you can be a private practitioner, work in an agency, whichever, and be able to bill under Medicaid. Certainly not Medicare. That's what ACA has been fighting for. But it's really determined by whatever state. Like, for example, I'm in Michigan now, and I cannot be a private practitioner and take Medicaid, but if I worked in an agency, I could. So it's just whatever the state legislators deem appropriate. And I know that New York is relatively new to the licensing field. You're not called licensed professional counselors. I don't know what your moniker is in New York, but your profession is relatively new, as it is here in Michigan too. But
Yes.
yeah, Virginia LPCs have been around for a really long time, and Virginia, in spite of all the other stuff that's been going around in Virginia, it's a fairly progressive state. So New York is still a little bit backward in terms of what's available to you, and especially in just third-party billing, period, from what I understand.
Yes, correct. You're correct.
And I think this brings up a good point, is that when states are doing this, or whenever any legislative body is starting to provide those services under Medicare, or in the instance of for the feds and Medicaid, or Medicaid in the instance of the federal government, or the Medicaid in the instance of the states, that's an important milestone. Number one, because we accomplish our goal, but once they do that, it's very hard for a state or the federal government to go back in there and start taking those provisions away,
right.
Because there's a huge permanency. There's an ability for them to repeal it, but once they start doing that, it gives us more momentum to keep pushing forward and make sure that's a milestone that we don't have to look back and try to go back and cross again, a threshold we don't have to cross again. And just kind of as a reminder, the bills 604. The only co-sponsors we have right now are 11, and it's Daniel Akaka from Hawaii, John Barrasso from Wyoming, Mark Begich from Alaska, Jeff Bingaman of New Mexico, Barbara Boksh of California, Sherrod Brown of Ohio, Kent Conrad of North Dakota, Richard Durbin of Illinois, Daniel Noe of Hawaii, Tim Johnson of South Dakota, and Jeff Merkley of Oregon. So only Oregon and Hawaii have both of their senators on. We only have one Republican, so if you're in a state that is represented by a Republican senator, we really need Republicans to sign on to this as well. And if neither of your U.S. senators are on that list, we really need them to start coming on board as co-sponsors. And
who was the first one you said, Art?
Daniel Akaka.
Okay. Okay, so I know that the Leadership Institute is coming up soon, and we do have a representative that's coming and should be addressing the issues around Medicaid or Medicare. So I did the same thing last year, and hopefully there has been at least some movement, at least with co-sponsoring. So, yeah, it's been a long haul trying to get on Medicare. I'm not exactly sure how the NASW was able to do it as quickly as they did, but, obviously they have something going on that we as a sort of grassroots organization don't.
Actually, I heard that the reason social workers were able to get on is because when they were writing the initial law, one of the congressman's wife was a social worker, and she made sure it got put in there.
Figures.
A long time ago.
Yeah, that figures. Okay. And I know the NASW they have some pretty strong lobbying groups, like ACA has good lobbying groups too, but we're fairly fractured and I'm sure, Art, you're aware of that, about how fractured we are as professionals, as licensed professional counselors. There are different terminologies all over the United States. So, if we were to all come together, maybe that's something ACA can really look at, is coming together and, having one particular name for the profession like social workers do. If we were licensed professional counselors or professional counselors or whatever, that may carry more weight, but we're pretty fractured state to state.
Yeah, I think though this is an issue too that we can all agree on, that we want to get this passed and realized sooner rather than later. But I think, key component of that is getting out and talking to your members of Congress, talking to your senators to make sure that they're aware of these situations and aware of this legislation. So.
Yeah, absolutely.
I have a quick question. Do we know when the TRICARE, when LPCs can start to get credentialed through TRICARE?
Well, we know that, or we're actually waiting the final TRICARE regs to come out. I think you all saw that there was a period of public comment that has since passed. ACA did send in some formal comments and criticisms and suggestions for the TRICARE regulations, mostly because, of course, we're concerned with the KCREP issue, and we don't want to have counselors shut out of that are good counselors and have gone to, institutions that are not KCREP accredited. But we're awaiting the final word from the Department of Defense and those coming out. Unfortunately,
this is Johnny Jenkins from Atlanta, Georgia.
Yes, sir.
I am an LPC, and I actually have a client who has military benefits, and I've seen her for a couple of sessions, and it looks as though they are going to pay me.
Is she active duty?
Her husband is retired, so the insurance is billed through TRICARE South.
Yeah, as long as it's my understanding, because I'm a TRICARE provider too in private practice, and if it's a family member, you can see them. But if it's an active duty or a retired, they have to go through their VA.
Yeah.
Okay, I've never had that experience, so I'll wait to see what happens when that comes. Okay, I understand now.
Yeah, we're unfortunately waiting. It's kind of the same situation with the Supreme Court. We're just waiting to see what they're going to come out and say.
Okay.
Art, I have one other question about KCREP, because it was my understanding, and please correct me if I'm wrong, that KCREP has not been particularly involved with what happened in Arizona regarding the discrimination. Is that correct?
Unfortunately, I can't speak to that issue just because I wouldn't know. I've actually only had the opportunity to meet the KCREP, any member of the KCREP staff once, and that was at the national conference back in March, ACA's national conference. So I couldn't speak exactly to what they're doing and which states they're involved in.
Okay, thank you.
Are there any other questions?
Yeah, Art, this is Greg from Ohio. How are you?
Fine, Greg. How about yourself?
Good, thanks. Do we have any idea when the regs are going to come out about TRICARE? Do we have any idea on a time frame for that?
No, I would guess they would be this calendar year because, they've already gone through the process of issuing their drafts and having the public comment period.
Yeah. Okay.
But we're hoping again that it's something sooner rather than later. But I don't think this is something that we're going to have to wait a year on. If I was a betting person, I would say probably at least by the end of the calendar year, we'll have something back from the Department of Defense.
Okay, good. Perfect. And I know the question that came up about Medicaid, I know in the state of Ohio we can't, there are certain programs that we can bill under Medicaid, but most others we have to be working under either a psychiatrist, a psychologist, or a social worker. There's just a few limited cases where we can see certain people, but we still have to be supervised. So all that doesn't make sense, and that is on a state-by-state basis, as was mentioned. You just have to lobby the state legislature, and the state counseling board really needs to step up and try to get those things changed. We've been, and then quick update on Medicare with what we've done. We've had a couple workshops that we've done. One was our Legislative Advocacy Day at the State House, and we had about 60 folks in attendance, so we got letters written on Medicare specifically, Bill 604. And then we've done some other things too. So, I've done a couple other trainings where we've gotten, one we had 45 participants, and they all wrote a letter to both senators, one thanking Sherrod Brown and the other urging Senator Portman to sponsor it. And so we've been quite active in Ohio and kind of moving this stuff along. So hopefully we're seeing some of the other things in other states as well. So it's just a quick update for you guys. So.
Well, we appreciate your work, sir. That's what needs to happen, and definitely, thank the senators that are on there and push the ones that aren't. So.
Perfect.
Okay. Are there any other questions or comments?
Art, it's Cecilia Manley in Connecticut.
Hi, Cecilia.
Hi. I just wanted to let everybody know we had a nice meeting with Representative Himes here in Bridgeport, Connecticut. Three of us counselors, 2 LPCs, one about to be licensed, and he was quite attentive, and I'm still trying to get through to Senator Lieberman's staff and ask for a meeting. But I just want to encourage everybody to just contact your legislators directly and ask for a meeting, because there's a good chance you'll get one, and it's, that face-to-face contact is helpful. He's a Democrat, so it's not, our target, but every little bit helps.
That's right, and it's relatively painless, right, Cecilia?
Absolutely.
Yeah.
Absolutely, and we, I think we've established a relationship with his staff that they'll call us if, hopefully they'll call us if they have any questions on mental health or need support from us, and we'll see how it goes. Senator Lieberman, he's outgoing soon, so I don't know if we'll actually get the meeting. And I wonder if, having attended the town meeting for Himes, I think that what you said earlier is right, that, get on their email list. They make you sign in to those town meetings, and they have your email. And I think they might look that kind of up when you contact them and see, do we know this person? Are they involved?
No, most definitely. And I want to thank you and the folks up in Connecticut. And just like you said, we encourage everybody else. And if you have questions about trying to set up a meeting, or if you need some help, feel free to call me here at ACA so that we can help you do that, because it's part of my job to help you all do that and contact your members of Congress.
You were really helpful, and they asked for the info sheets about the legislation before we met, and all of that was so helpful. It made the brief meeting more substantive. We didn't have to try and remember all the facts about the bills. It was very helpful, and it was easy, and I just hope everybody else, takes the initiative to do it. Don't be shy about it.
Absolutely.
And I want to piggyback on something that you said. This is Johnny again, live from Atlanta. If you have a chance, going to those town hall meetings are the best way to meet, like your rep, because usually it's on a Saturday morning. There may be only 10 or 12 people there. So you actually can get your question answered in person. So,
that's right.
So those are great opportunities, as opposed to scheduling an appointment and sitting down. It's a much easier way to get access.
That's right. It all starts with that first step of public engagement there.
This is Andre Sutton. I'm the incoming ACEG president, but I'm also an employee of the VA. And I know there were some questions. I kind of came in just a couple of minutes late, but I know there were some questions about the internship. And I just wanted to know, for clarification, were you talking about for individuals that are completing their studies looking for an internship, or were you looking for developmental positions within the VA for that?
Well, I think we're concentrating more on the former, but we don't want to leave out the latter either. But definitely,
okay.
We're looking at folks that are coming in and finishing up their studies, because again, as we said before, that's a guarantee. I won't say a guarantee, but that's a very clear-cut pathway to employment in the VA that we're being shut out of.
What I would say to that is, it probably is a case-by-case basis, because I actually I worked as a voc rehab counselor, and I'm retired military, and I came into mental health afterwards, and I actually did my internship at a vet center. But it was the outreach that I did as an individual to the team leader, the person that was in charge of that particular unit. I'm not real sure whether the VA has any blanket, policy that says this particular group will get in across the board, even for social workers. I think it's always a case-by-case basis, where you basically, if you have a relationship between the facility and the school, where they can have sort of like a feeder type thing. I was the first one from the College of New Jersey to do their internship with the VA that we knew of in recent years. And as a result of them taking students like myself, then they started sort of a trend in terms of they will now take more interns out of that particular institution. So I'm not sure whether or not it's going to come from VA leadership as much as it's going to come from a groundswell, if that makes sense.
Well, I think it's both because, number one, let me congratulate you and thank you because you're the trailblazer. You're actually the first person I've met who's a counselor that was able to do that. And it is actually a blanket policy from the national office, from the Office of Academic Affiliation, and part of the thing part of the fight that we're having with them, because they do set aside spots for psychologists, for psychiatrists, and for social workers, and they've got a specific number. At least on the internships that are paid internships, they
right.
have to have
now that may be
out.
the truth. I'm sorry to interrupt, but yeah, no, I was not in a paid internship during that time frame.
Yeah, and that's what our critique is that if you're gonna have a policy at the national office for every facility you have, and you're setting aside slots for psychiatrists, psychologists, and social workers, you need to have one for counselors.
Right.
Because that's just only fair. But I thank you for that, because by doing that and kind of breaking through that ceiling, that's allowed other counselors to come into that area and really educated the local staff on the fact of who counselors are, what you all do, and how you can help out with our vets.
Absolutely. Thank you for saying that. But, yeah, and some of the positions just to kind of consider are the readjustment counselor positions as well as the vocational rehabilitation. They take LPCs with typically no problems at all.
Absolutely. And we've had some productive meeting with the folks at that run the rehabilitation centers and Dr. Botchus, who works with that and runs the vet centers. Unfortunately, the other folks at the VA are not as enlightened, I would say.
I can't answer for everybody. I just wanted to give my my experience.
And thank you for your service.
Not a problem. No, thank you for saying that as well. I think that we do good work in ACA, and I'm hoping, we can continue to grow within the VA. To make sure that everyone knows our presence is needed and, and can be leveraged in many different ways within the agency.
Mm-hmm. Okay, well,
excuse me, I'm sorry. Could you share which VA that is in New Jersey? What location?
Well, it's a vet center.
Okay.
Right. So, if you go to va.gov and you click on locations, you'll be able to find the vet center that's closest to you. And the person that is typically the head, counselor or therapist there would be called the team leader. Okay.
So you're saying that it's pretty much open in New Jersey as to any location, not one particular place.
Well, I would say that if you were seeking an internship, I can't speak to the paid ones, but I'm saying if you're looking for the internship experience, that's a place that's been more receptive to taking individuals with the LPC background.
Okay.
Within the VA network. Sure.
Thank you. Thanks for your help.
Hi,
Absolutely.
It's Cecilia again. Can you just, I'm sorry I didn't catch your name. Can you distinguish between vet centers and the VA centers? Distinguish between them for us?
Well, I'm not sure that we really don't have in our network a name called VA centers. The vet centers are an offshoot of the VA hospital in which they provide readjustment counseling for individuals within the community.
Okay.
And they're typically geared towards helping
combat
vets and their families as well, and it's much more of a kind of a drop-in center with less of the formalities that you would see in a clinic or a hospital, because the idea, and you can correct me if I'm wrong with something, but the idea is that it's a more kind of comfortable, open place where people can just come in and talk to somebody, instead of having to jump through some hoops, some bureaucratic hoops that may hinder folks from coming in and seeking treatment or seeking some assistance.
Yes, and they have group counseling and individual counseling along those lines. And, you know, there's a combination of social workers, family therapists, as well as LPCs and licensed mental health counselors working there. And in a lot of cases, they do have some psychologists working there as well.
Thank you.
Thank you.
Sure.
Okay, anybody else? Okay. Well, again, if you all have any questions on these issues, feel free to contact either Scott or myself, either by calling ACA or emailing us. And if you have any other questions, issues, or ideas, feel free to contact us as well. And thanks for joining us. Again, if you want to go back and listen to the call, it's going to be posted online pretty soon, and that way you can come back and listen to it if you have any other questions or didn't catch something. But thanks a lot for joining us, and we'll be speaking to you all soon.
Thanks,
Art.
Thank you. Bye-bye.
Thank you.
Bye-bye.
Bye-bye.